Hey, what do you say? This is Boz at Men Speaking Out, and this is episode 81, and we are honored to have the good doctor and the good Dr. Judson Brandeis here with us today to talk about does size matter? Now, Dr. Judson, I'm sorry, correct me if I've murdered your name. I've been called worse.
It's perfect.
Give me just a second, sir. I got a little echo going, and I think that's me. So I want to make sure. Give me just a second. There we go. There we go. And sometimes when you have the YouTube open and the podcast open, you hear yourself twice. Like, was it? Did I sound that bad? No, but nevertheless, definitely want to welcome you to the Men Speaking Out show. And I want to give my listeners, once again, this is about Does Size Matter? And we are talking to Dr. Judson Brandeis. And I'm going to give you a little background on Dr. Judson. And then, of course, Dr. Judson, give you a little background. And please have you share a little bit about yourself to our listeners. All right. As award-winning urologist and sexual medical expert, clinical researcher, physical educator, and caring clinician and surgeon, a graduate of Brown University and Vanderbilt University School of Medicine with urology surgery residency at UCLA, and a postdoctorate fellowship at Harvard. Today, he specializes in emerging fields, sexual health and medicine. Doctor, thank you, and welcome to Men Speaking Out. Please fill the listeners in on something that I did miss or didn't cover.
Oh, thanks Boz for having me on the show. And I've been in clinical practice for almost 25 years. I'm up in Northern California. Let's see, I helped pioneer surgical robotics for prostate cancer. I built the Kidney Stone Center. I helped pioneer MRI-guided prostate biopsies for prostate cancer. And about 5 or 6 years ago, I branched out into sexual medicine and regenerative treatments like shockwave therapy, PRP for sexual medicine. And, as part of that, a lot of guys would come to see me for penile enhancement. And a lot of guys would come to see me who have had different procedures for penile enhancement that were total disasters. And I had to put together the pieces for them. And so, I became really interested in the problem of penile enhancement. Not that, like, honestly, Baz, I could care less how big guys' penises are. Mm-hmm. Right. And the penis has two purposes: urination and procreation. So as long as your penis is capable of urinating and procreating, the size of your penis is perfectly fine. But in this society where people are watching pornography, where guys have big penises, or, guys in the locker room talk about big penises, or girls talk about big penises, there's a social stigma with having a small penis. And so to a lot of guys, size matters. And so they'll do things to try to improve their size. And sometimes it's either expensive or it's disastrous or it has consequences. And so I have a background in clinical research. I did research at American Red Cross. I did research at Harvard Medical School. I did research at UCLA. And so I created the P-Long study, which is a study of a protocol that I developed to improve the length, girth, and function of a healthy guy's penis, right? So if you have erectile dysfunction, you're not really a candidate for P-Long. But if you're, say, between 20 and 55 and you have a healthy penis and you want it bigger, the P-Long protocol is totally safe and effective. And so over a period of 6 months, guys can improve the size of their penis about 15%. So that translates almost into about an inch of length, about a half an inch of girth, and improved function.
Okay. Wow. Okay. Well, thank you for sharing that with us. There's a lot of, between social media and like you said, movies and masculinity and things of that nature. And I was doing some research myself, and then I was looking at a study. Of course, obviously, it's nothing new to you, but I was looking at a study, the International Society of Sexual Medicine, and they were saying in 2019. On a survey with 4,200 American men, that 26.4% were dissatisfied with their penis size. So that's basically 1 out of 4 men, right? I mean,
and the other 3 were lying.
It's just, it blows my mind because every man wants a big dick. Every man does. I mean, hey, what are we talking about? You said locker room talk, right? How many girls you can get, right? You know, hey man, I made her scream, I made her holler, I made her this, I made her that. Hey, I beat it up, right? That's what we talk about, and it's just keep it real, 100, right? So, but at the end of the day,
Make them holler, but in the wrong way.
right? In the
Like,
wrong
take out
way.
the trash, or
right? Are you hurting them? Are you hindering them? Right? Exactly. Are you embarrassed to tell the truth about what really happened? You shouldn't be talking about it anyway. Truth be told, that's an intimate moment between you and that person. Shouldn't be shared across the board. But sometimes we as men, we lie on that dick. That's what we call it, right? We lie on our dick. So, in your research, what is the average penis size?
Yeah. So in America, it's 5.1 inches.
Okay.
So there are studies out there that look on a country by country basis. So if you look at North Korea, it's 3.8 inches. I think that's why they're always launching those big missiles.
Compensating. Okay.
And then if you look in the Congo, it's 7.1 inches.
Okay. Well,
And then us in America, we fit in at around 5.1 inches. But like I said, the purpose of the penis is procreation and urination. And so as long as you can do those two things, you're fine.
Mm-hmm.
I'm not here to tell people like you need to have a bigger dick.
Mm-hmm.
But what I'm here to tell people is that if that's something that you choose, like 300,000 American women each year get breast implants, right? Not all of them have breast cancer.
Right.
It's a choice that they want to have bigger breasts, right? And that, as long as you can do it safely, God bless you. The problem is with the penis, there's really no safe and effective way to increase the length, girth, and function of a healthy penis until I published the P-Long study in andrology and presented it actually at the International Society of Sexual Medicine meeting and the Sexual Medicine Society of North America. So it's sort of that technique that I've developed has been validated by my academic colleagues.
Okay. That's good to know. I with everything out here in the market, you got extends and you got these different,
gas station pills.
Gas station pills.
And that's the thing about sexual medicine is that like you can make these outrageous claims, and as long as someone doesn't kind of bust you, that you can continue to make these claims and sell stuff. And the thing is, guys aren't going to return. Like, say you got a contraption that's going to, quote, increase the size of your penis, like double the size of your penis, right? And then you try it and it doesn't work. Are you likely to go down to your local UPS store and have them package it up? Like, hey, Joe, oh, the penis extender didn't work for you, huh? Well, let me package it up and send it back to Amazon.
Yeah.
No, you're just gonna like eat the money and
exactly.
Leave between the tail, with your tail between your legs. And so that's the problem with sexual medicine, really, is that anything you do, you really should try to validate, that there's somebody real with an MD behind their name, with some research that's been done, that's presentations at scientific meetings, that it's a real product instead of stuff out there. Like there was a shockwave device out called the Phoenix, right? And
I see it as a long little black device, right?
Yeah, it's like $700 to $800.
Yeah,
and
yeah.
There's no evidence ever done that it works, right? Because they actually contacted me to do the clinical research study to show that it worked. And then when I told them what was involved in the clinical research study, and when I told them that, if the results weren't good, I was going to still publish that the results weren't good, I never heard from them again. And so it's, they were making $10 million a month selling these things.
Wow.
I know the whole story. I know the people involved. They were making $10 million and it didn't really work.
So how can they put something like that on the market without it being like approved by the FDA or some sort of, gatekeeper to make sure that you're not just selling pipe dreams?
Yeah. I mean, there are a lot of people that cheat on their taxes, but until the IRS comes and busts them, they get away with it.
Good point. Wow. I didn't think about it that way too, right? Because it's just amazing. You got the gummies and you got the different the shock waves, you see the websites and all these.
Oh yeah. I mean, well, the thing is, properly done focused shockwave in a medical office with people who, like, I used to travel on the country training people to do that. It works just fine in properly selected patients. So, but the problem is that it wasn't a focused shockwave device, and just watching a video and doing it on yourself isn't proper training.
Mhm.
And so, people spent $800, they got suboptimal results, and they were afraid to send it back because it was embarrassing.
Wow. So could you share with me just maybe a couple of examples, some humorous examples, right, about some of the individuals, the attempts of them trying to increase their size, right? What have you in your history?
Yeah. Well, I mean, the sad thing is it's not really humorous. So,
Mm.
um, you can use fillers, right? So the same cosmetic fillers that they use for lips and chins and
Like the
and
Botox type stuff.
cheekbones. Well, not Botox. They're called fillers. So it's
Okay.
either hyaluronic acid or PMMA, that kind of stuff that they put in women's lips to make them look like a duck. But you can put that in a penis, and it's expensive, right? So it's about 10 grand. And then that stuff will dissolve over time. So every 2 years, you need to put another $2,000 or $3,000 worth of filler into the penis. But the problem is that will increase the girth, right? But it doesn't increase the length, and it doesn't do anything for the head of the penis. So now you have a thick shaft and a little head. And we call that a pig in a blanket penis. And pig in a
Wow.
blanket's great at cocktail parties, but it's not
Yeah.
really good in the bedroom.
Yeah. Especially at cocktail parties, right?
Yeah,
Yeah.
oh, that's a good one. I haven't even thought of that one.
Yeah. There you
I
go.
like
Yeah.
that.
There you go.
Okay, and then there was an operation that some folks did maybe 10, 15, 20 years ago called cutting the suspensory ligament. So the suspensory ligament is a ligament that attaches to the underside of the pubic bone,
Mhm.
and basically what your penis hangs on. And so if you cut that, your penis hangs lower. So you look better in the locker room, but it doesn't change the length of the penis.
Mhm.
And now when you get an erection, it points towards your toes.
Oh wow.
And then you get scar tissue. And because half of the penis size is on the inside and half the penis size is on the outside, you don't get the benefit of an increase in size of the penis on the inside. So now all of a sudden your penis is shorter.
Jesus.
So now
Now,
your penis is shorter and it points towards your toes.
wow. Wow.
And then there's something called the implant or the pneuma, which is almost like a silicone taco that goes under the skin and above the erectile bodies.
Mhm.
And that will increase girth about 5 centimeters, and it increases flaccid length, but it doesn't increase rigid length. The problem is that a percentage of those patients will get infections or chronic pain, and those sometimes need to be taken out. And so I had a patient, 25-year-old male nurse, came in to see me. He had a implant or pneuma placed, got an infection, was in the hospital for a week, had to have the thing removed, and then had 2 additional operations to correct the problems from all the scar tissue that he developed from the surgery and the infection. And so, here's a guy with a perfectly normal penis where he was able to urinate and procreate. And now all of a sudden he's totally messed up. And so that's the downside of doing something surgical for increasing the length, girth, and function of the penis. Whereas the P-long, right, it's a length extender, it's a girth extender, it's PRP, which is platelet-rich plasma,
Mhm.
and it's my nitric oxide boosting supplement called Affirm, which is also totally healthy. So none of the patients in the P-long study, and there were 30 patients in the P-long study, had any side effects whatsoever. And none of the patients that I've been treating with P-long in the office after the study, which now are hundreds of patients,
Mhm.
had any problems or issues.
Now, with these studies that you're doing, I guess you said more like I don't know if you're going to call them clinical trials or
Yeah, it's
whatever,
clinical
but
trial. I
they're
mean, it was
trials.
listed by clinicaltrials.gov, which is the
Mhm.
NIH website. I was
Mhm.
institutionally review board approved. I mean, I did the study the right way, the way you're supposed to do it.
So with the conditions of your actual clients, or shall I say subjects, were there like was some like this group of gentlemen, they smoke or normally, or this group of gentlemen or they drink, or these guys are in healthy shape? I mean, how did you like determine, or within the folks themselves, their lifestyles, did that play a role in some having better results than others?
Yeah. So, I mean, they had to have normal erectile function.
Hmm.
And so if if you're 35, 40 years old and you're a heavy smoker and you're overweight, you're going to have some degree of erectile dysfunction. I mean, 40% of men in their 40s have some degree of erectile dysfunction, right?
Mm-hmm.
So this is not for men with erectile dysfunction, because at that point you can't even fill the penis that you have up with enough blood, right? This is for guys that are like reasonably young, healthy, and they want a bigger penis. And this is a safe and effective way to do that.
Okay. Well, let's talk a little more about your approach, right? I would like to know more about the P-long and so forth. And so please, let's talk about the whole start to finish. What does that look like from your approach?
Absolutely. So there is, you want to increase length and you want to increase girth, right? So you don't want to just a long penis without girth. That's called a pencil penis. And you don't want a girthy penis without length. That's called a pig in a blanket penis, right? You want a nice, long, thick, symmetrical penis. And so the collagen, which is the connective tissue that lines the inside of the penis, there's two different directions. There's a lengthwise direction and a circumferential direction. And so we use something called the RestoreX device, which was developed by a friend of mine at the Mayo Clinic to increase length. And you put that on 20 minutes in the morning, 20 minutes in the evening, right? So in the P-long, you actually have to do some work. It's about 30 minutes in the morning, 30 minutes in the evening. And then there's a penis pump, vacuum erection device by the Dr. Joel Kaplan people. And that you have to use to stretch the girth of the penis. And that's 12 minutes in the morning, 12 minutes in the evening. So, about 35 minutes in the morning, 35 minutes in the evening is the work that you have to do. Okay. And then you take a firm nitric oxide booster. Nitric oxide is what your body needs to open up blood vessels. And so I'm actually just presenting in a month a study at the Sexual Medicine Society of North America that taking a firm before you go to sleep increases nighttime erections 30%. Right. And it's a totally healthy supplement with no side effects. Nitric oxide boosters are used by elite endurance athletes to improve circulation. They're used by bodybuilders. They've been around for, it was actually the technology was discovered when I was at UCLA in 1998. And one of my professors won the Nobel Prize, and they wrote a paper on how Viagra works. A firm nitric oxide booster is, a fantastic supplement really for anyone over the age of about 30 or 40. And then the secret sauce, the magic, is really the PRP. PRP is platelet-rich plasma. So the platelets in our body have two functions. One function we all know, right? Platelets stop bleeding. Correct. But the other function is that they trigger the regeneration or the healing of tissue that's been damaged, right? So the good Lord put together this amazing system where if you get injured, say you cut your finger, you start to bleed, that tissue that got injured sends signals out called cytokines, and the platelets hear those signals and they hone to that area that's bleeding. And they release clotting factors, which stops the bleeding, but they also release growth factors, which start a cascade that regrows tissue in that area. So you get a clot, you get a scab, the scab falls out, the tissue grows back. And the reason that tissue grows back is because those growth factors are released by platelets. And so what we can do is we can take advantage of that, right? So we draw blood, we spin the blood down, the red blood cells are heavy, so they go to the bottom. The plasma, which is the water that your blood floats in, goes to the top. You can take off some plasma. And then the platelets and the white blood cells sit in the middle. We take the platelets off, we resuspend them in some plasma, and then you can inject it really anywhere in the body. So they use this for hair regrowth. They use this in the gums in dental surgery. They use this in orthopedics. And because of a friend of mine, Dr. Charles Runnels, who pioneered this, you can inject it into the penis, which is called a P-shot. Or you can inject, for women, you can inject it into the clitoris, which is called an O-shot, which helps improve sexual function in women. But what we found is using PRP in the penis once a month for 6 months helps accelerate the benefits of stretching and traction.
Okay, so if someone was to follow your, basically all the steps that you that say, what, Doc,
Dude, you want guys to inject platelets into their penis at home?
No. That'd be messy. And you know what? Full disclaimer, we're not telling the guys to do that. You're on your own if you want to mess up your manhood. That ain't what we're trying to do here.
You know,
Right?
quick. No, well, the thing is, the reason I say this, quick story. So I was in my office maybe 5 or 10 years ago. I got a call from the emergency room, like, "Doc, you got to come in right away." And I'm like, "Dude, I'm like in the middle." You know, I'm talking to the ER doc. I'm like right in the middle of my day. I got patients stacked up. He goes, "No, you got to see this. You got to come in right away." So I hop in my car. You know, I was across the street from the hospital. So I zip over to the emergency room. It's a 17-year-old kid, right? And I don't know. He was probably getting with a girl for the first time, and she looked at him, and he was uncircumcised, and she made some comment. And so he called up his parents' health insurance company and asked, you know, "Can we get an elective circumcision?" And the insurance company was like, "No, you can't do that." And so, you know, what is a 17-year-old to do? Well, they go on YouTube. This is a true story, right? He goes on YouTube. He gets a pair of scissors.
Oh, Jesus Christ.
He gets some rubbing alcohol, right? Cleans off the scissors really carefully, make sure it's sterile and everything like that. And he starts to cut. And there's two big veins on the top of the penis, right? The deep and superficial dorsal veins of the penis, right? So he starts bleeding like hell. So when I saw the guy, he had this big mound of gauze that was all blood soaked on top of his penis. Geez. So I took the gauze off and I stopped the bleeding and I looked at him. I'm like, "What were you doing?" He's like, "Well, you know, I was giving myself a circumcision." And I looked at him. I said, "Well, assuming that you were able to get the skin off the penis," I said, "what was your plan for putting it back together?" And he looked at me, he goes, "Well, I hadn't gotten that far in the video yet."
Oh, shit. Are you kidding me?
No, it's a true story. I mean, it's like Akalani's high school, right? It's like a upper middle class community in the San Francisco Bay Area, really educated folks. But I mean, that's the stupidity of men. I mean, let's be honest, guys do stupid ass shit.
Yeah,
right?
we do.
So the idea that guys might take the P-Long protocol and not go to one of the P-Long trained physicians around the country that we have is not so far-fetched.
Yeah, you know, I've done a lot of crazy shit at 16, 17, 18, 21, 25. You know, came home drunk, you know, maybe, you know, did some craziness, but I've never even considered taking a sterile pair of scissors.
He did sterilize the scissors. You got to give him credit for that.
Yeah. Dip in alcohol, burn the tip, whatever you want to do. Jesus, tap dancing Christ. You know, okay. All right, that visual was nothing I wanted to see. Kids, don't try that at home.
Don't try that at home.
Don't try that at home. You know, exactly.
The P-Long protocol, don't try that at home.
Yeah. Oh, wow.
Go to a highly trained professional.
Right. So let's talk about some successes, right? I mean, obviously you got this program, you know, that you're promoting, and you know it works. Obviously, you know, you're a medical professional here. Let's talk about some successes behind it, right? I mean, I'm sure you have a number of them. Let's share a couple if you don't mind, please.
Yeah, I mean, it's really gratifying because the thing is, like, you know, my reputation as a physician is the most important thing that I have, and it's really the only thing that I have. And so in the study, I did all of the injections for all of the patients. So I got feedback from all of the patients every time I did an injection. And so if patients were having problems or patients weren't having success from the protocol, you know, I would know it. I'd be the one that I would get the complaints, but patients are super happy and they're very gratified. And it's, you know, it's a natural increase in size. It's not like, because that's the other thing is that, and I'll get to the question that you're asking, but
sure.
You know, the thing is, I don't think women or partners are looking for just size. They're looking for confidence, right? And so, you know, if you have a big piece of silicone in your penis just to improve size, I don't think women will look upon that favorably. They'll look on it like, this guy doesn't have the confidence that he needs.
Yeah.
In bed to be with me. And so I think women would rather have someone who's confident in who they are rather than someone who spent $10,000 to have, you know, filler squirted into their penis.
Yeah.
Now, if you could have both, that would be fantastic. And I think that's what the P-Long does, is it gives guys an increased size, but no one's going to know that you were a P-Long patient.
Right.
But one of my favorite stories was a patient who was in the study that got great results. I think he put on 1.5 inches in length and about 1 inch in girth. And he came in for his PRP injection, and he said, doc, this has been great, but this is my last treatment. And I was like, oh, like, how come? Like, he said, well, I talked to my wife, and she said, now I'm too big for oral and too big for anal, and I have to leave at least one orifice open.
Sounds like a good problem.
Yeah. So those are things that not all of us have to think about, but those are real P-long problems.
Yeah. I was like, doc, I can't come back anymore. Like, why not? Well, it's costing me a little bit too much money. No, not that, right? That's not that right there, right? No, it's just a little too big for the entry and exit. You know what I mean?
Exactly.
Oh man, oh my goodness, that's great. But so that's the success story, right? So I mean,
yeah,
obviously,
absolutely.
to grow in girth and width, and I think that's fantastic. I do know that this has been around for a while. This P-long study, this has been around for a while. I did some research years ago, right? Years ago, and there was a facility here in Indianapolis that actually was talking about the O shot, right? I was just like, interesting. Women have problems, and I did it because I'm like, do women have problems like that too, right? Is it something that, or I want to say a problem, confidence. I'm like, and then of course that led to the P shot, and I was like, wow, this is the new technology that's out here today. It just blew my mind because so many people look out at others, and instead of doing something for themselves, they want to be like what they see on TV or in the movies, right? Whether it's implants or whatever. And it's like, dude.
Well, I think that the issue is that a lot of men, or a lot of people in general, are looking for shortcuts.
Yeah.
Right. And so I treat a lot of men with erectile dysfunction, and they just want a pill, or they just want a quick, easy solution. But the quick, easy solution really is lifestyle.
Yeah.
Right. Because the thing is, like, I look at patients that come in and I talk about for shockwave therapy, and I'm like, I can do this for you, but if you don't make these lifestyle changes, it's not going to work, or it's going to work for a couple months, but then it's not going to work after that. So, don't drink alcohol, don't smoke, don't do drugs, don't eat too much, exercise every day, stretch every day, do yoga, meditate,
this is interesting.
That's all basic stuff that's going to keep you healthy, so that your penis is able to stretch and get good erections that are good for intercourse into your 50s, 60s, 70s, 80s. I even had a patient the other day. He's like, doc, he's 91, right? He's like, doc, can I ask you something really embarrassing? I was like, at 91, what could possibly be embarrassing?
Right.
He's like, can I get some samples of Viagra? I said, dude, at 91, if I was asking for Viagra samples, I'd have it on a big billboard.
Yeah, exactly.
Right? But he was a vegetarian.
Wow.
Right. So, when I did an ultrasound, his blood vessels looked fantastic.
Wow.
He was an athlete. He kept in shape. He took good care of himself. Right. So if you take good care of yourself, you can have sex into your 90s. And if you don't take care of yourself, by the time you hit your 40s, the statistics, the data from the International Society of Sexual Medicine and the Sexual Medicine Society of North America show that 40% of men will have some degree of erectile dysfunction.
Doc, you're spot on. Spot on. Because in discussions I've had with some dear friends of mine, who feel they can come talk and be themselves, and I welcome. I don't, no judgment here whatsoever. And we're real quickly, I got folks watching the podcast. I'm going to ask the women who are watching the podcast, if you wouldn't mind commenting and saying, if you got a question, please comment or ask it. But I want to ask you a question. What's more important to you, right? Does size matter? And of course, you can respond in the chat, and we'll take them as we get them. But
I think a really important question is, what matters more, size or confidence? Is it the size of the nail or is it the hammer that drives it?
Yeah. That's actually a great, very good question. And you ladies have heard, the doc ask the question. So my question for you is though, of course, obviously in a perfect world, no drinking, no smoking, exercising every day, or at least getting a good 30 minutes of, meditation, yoga, things like that. Those are great life habits to change so you can age gracefully.
And the great thing about it is for the most part, they're free.
Yeah. Yeah.
Right.
Yeah.
In fact, I had a patient the other day, he's drinking 6 beers a day.
Jesus.
Right. And so like I said, well, how much does a beer cost? And so we figured out like because he was complaining like, well, doc, shockwave therapy is expensive, this is expensive, that. I said, if you stop drinking, it's going to save you $7,000 a year.
Wow.
And he just kind of looked at me like, oh, okay.
Yeah. 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 Yeah.
Most of those things I rattled off are completely free. Now, are they easy to do? No, I mean, we live in a stressful, complicated world. And so it's, sometimes it's not easy to get 6 to 8 hours of sleep.
Yeah.
Sometimes at the end of the day, you need something to de-stress. But if what you need to de-stress is alcohol or drugs or smoking or whatever, in the end, you're creating more problems for yourself than you're solving.
Thank you for sharing that. That's very good. Awareness for the listeners out here. I think that this is a question back in my mind. Once again, like I said, there's all kinds of gimmicks and all kinds of stuff out here that folks are just like, they still show a picture online with a man with a big dick, and they put in a bottle of pills next to him and say, you can be this too, right? And whatever. And folks are just taking that in like, oh my God, that's what I want. That's what I want. This requires discipline. This requires effort. It's no shortcuts to it, right? It's like the liposuction thing, right? Folks don't want to do the work. They want to get the lipo and they want to get it all taken out, but don't want to go to the gym, and burn calories the good old fashioned way, right? So the level of effort here that I have, my question is, right? Yeah, 30 minutes in the morning, 30 minutes at night. That's cool. But a person has to be really dedicated in order for this to be effective in that space, right? So my ask to you is, what, for the folks that you've seen that are very effective, like the success story you shared earlier, to the ones who had some success, but they wasn't as disciplined in doing the 30 minutes up, 30 minutes down?
I mean, in life, is anything really like gratifying or worth it if you don't have to work for it?
Yeah, the biggest investment.
I mean, if you worked so hard for 5 years to save up to buy a fancy sports car, or someone hands you the keys to a fancy sports car, what are you going to appreciate more?
Yeah.
I mean, you could go to a plastic surgeon and have them put pectoral implants in to make your chest look puffy, or you can spend a couple of years in the gym, getting your chest all puffed out. What's going to be more gratifying?
Yeah.
In life, you have to work for stuff. That's just the way it is. Sorry.
Absolutely. Hey, you know what? Amen, brother. Amen. Amen. Yes. So let's talk a little bit, let's talk a little bit about the website. Let's talk a little bit about what folks can learn, what they can see. I know it's like was it plong.com?
Yeah. If you go to p-long.com,
mm-hmm.
p-long.com, you can learn all about the P-long study, the P-long protocol. There's the paper that I wrote. There's presentations that I've given at scientific meetings. There's talks that I've given on penile enhancement. Like I said, I could care less how long guys' penises are. All I care about is that they don't hurt themselves in the quest for a bigger penis, and they don't get ripped off by shady characters who are trying to just take your money, right? Like I don't really need your money, but if this is something that's important to you, do it safely. And we have a network of 50 or 60 doctors that have been trained in the P-long protocol all around the country. So you don't have to fly out to the San Francisco Bay Area if you live in Indianapolis or New York or Florida or Texas. I mean, we have providers all around the country.
Mhm.
The other thing is I have a book called The 21st Century Man, which is the most comprehensive and medically accurate men's health book ever written. So it's over 900 pages, 101 chapters, 60 other physicians and men's health professionals that talks about every aspect of men's health for men over the age of 40, right? Because you got to learn how to take care of yourself.
Yeah.
I see in my office, I see hundreds of men, like really good people that work hard, take care of their families, perform well in their work, to help take care of their communities, and they don't know how to take care of themselves.
Yeah.
And
Wow.
that's the sad thing. I mean, I saw the guy just the other day, like 62 years old, and he had what's called a heart calcium score, which is a CAT scan of the heart that looks for calcification.
Mm-hmm.
And his value was in the critical range. I had to spend a half an hour getting him in to see a cardiologist the next day. And I mean, this guy, he's been working for the same company for 35 years. He raised a family and he was ready to drop dead.
Jesus.
Like literally drop dead. Because the thing is, for men, the first sign of heart disease in 1/4 of men is sudden death. Right? Where you don't get a second chance. So, you're working, you're like, I'm going to retire. I'm going to enjoy my life one day. And then boom.
That's it.
You're done. That's it.
Wow. You don't get a second chance at life. That's for
game
sure.
over, right? You don't have another quarter to put in.
And it's funny you said, well, not funny, but it's interesting you said it because a lot of us, even today, right? I was just talking to a couple of guys and my colleagues, listen, you're not at halftime right now, my friend. I said, you're in the third quarter, right? Literally. Some of us are in the fourth quarter as we speak, right? I'm 52 years old, right? So I'm like, hey, listen, halftime, if I make it to 104, hey, life is good, right? But I could be in the third and fourth quarter of my life as well, right?
I mean, the thing is, like, there was a study I just read the other day that looked at 20-year-olds versus 50-year-olds, and they gave them the same exercise routine in the gym. And then at the end of 3 months, they reevaluated them, and the 20-year-olds built 3 times as much muscle as the 50-year-olds.
There you go.
Right. So, I mean, like, even if you're doing the work, it's not going to pay off the same way that it was when you were 20.
The same dividend.
So think about the aging process like walking up an escalator, right? So in the beginning, you can actually walk up the escalator because it's not going that fast. But by the time you hit 50, it's going pretty fast. And so you're not going to make much progress up the escalator. And by the time you hit 60 or 70 or 80, the escalator is going really fast and you're going to be going backwards until, they put you in a box 6 feet under the ground. So, life does not get easier as you age. It gets harder and harder. And so, doing the stupid shit that a lot of guys do, like drink, smoke, stay up too late, all that kind of stuff, it gets harder and harder.
Yeah, it does. And, I was just talking to a friend of mine. I said, as I age, I want to, think like a 50-year-old, have the maturity of a 50-year-old. I want to have the body of a 30-year-old, but I want to fuck like a 20-year-old. and that's just what it is, right? So,
hang on. So you want to have the erectile function that you had when you were 20, but when you were 20, did you really know as much about women and how to please a woman that you know now?
I had no clue. It was just wham, bam, thank you, ma'am. I'm a 20-year-old, right?
Yeah.
I was going down, thinking life was a sprint, not a marathon.
Exactly.
Right? Yeah.
You're like a hummingbird trying to see how many like little flowers you could pollinate.
Yeah, exactly.
Right. But like that's not the way to please a woman. Right.
Mm-hmm.
So that's a way to brag to your buddies, about how many flowers you pollinated, but that's not really the way to.
No, I think now at the age I am, there's more to this, but high level, I think women.
Yeah, you want to be like JB Smooth. You want to be like.
You know what I mean? Yeah, like like intimacy. Into me, you see. Yeah. Right. Basically, is how I kind of look at that. Right.
Because most guys, and myself included, learn that the hard way.
Yeah. I think we all have. I think we all have. Well, Doc, once again, I'd like for you to share your URL with the folks, and how can they get your book, The 21st Century Man?
Yeah. So go to p-long.com to learn about P-long, and then to get the book, you can go to the 21st Century Man, all written out in letters, the 21stcenturyman.com, or you can go. I have a line of men's health supplements, including a firm that if you go to Affirm Science, AFFIRM Science.com, you can pick up some supplements. You can pick up a copy of the book. And then if you're interested in the work that we do in the office, especially if you're in the San Francisco Bay Area, but also I do, remote second opinions for people all around the country, just go to brandeismd.com, brandeismd.com. I also have a pretty good YouTube channel. So I put, tons of free informational videos out on all things in men's health and sexual medicine. If you just go to Brandeis MD on YouTube, I also have an Instagram where my people post stuff. I don't, I'm too old to know how to post stuff on Instagram, but
you too,
I have people that do that kind of stuff. But, we do really interesting clinical research. Like I said, we did the P-Long study. I did testing on the Emsella chair that showed that it improved urination, ejaculation. So a lot of guys have ejaculatory issues, but the Emsella chair will fix that. And then even we did a great study on Affirm, showing that it improves nighttime erections. And now we're doing a study showing that Affirm plus a PDE5 inhibitor like Viagra and Cialis has an additive effect. Synergistic effect. So anyway, go to Brandeis MD. You can learn about all those studies.
Okay, good deal, my friend. Well, I wanted to really want to thank you so much. I know that this is great information. I'm looking forward to to really digging more into this and recommending. I guess my question too as well. You have shall I say partner physicians all over the U.S. that could perform these activities, or shall I say, that support this P-Long process. So it's not, you don't have to be in California to take advantage of what you're offering. It can be done with anyone here. And is that list on the actual website as far as people are concerned?
Yeah, if you put your zip code in, it'll pop up.
Okay.
These are the providers that are close to you.
Awesome, dude. This is great. I appreciate it, man. I appreciate you. I got to have you back. I want to learn a little bit more about, especially the 21st century man. That I can see. I'm looking at the book right now behind you, and I just think like, wow, this got 100 some odd chapters.
Yeah, it's a pretty thick.
It's book. Okay. I love a good read.
Yeah,
I love a good read.
Well, I mean, the thing is, I read books, and I'll read a 300-page book, and there's about 4 pages of information in there. And it get really irritated. Like, why did you just put these other 296 pages in there? But this is 900 pages of pure information. I write for men in a style that men like. And so if you were to summarize the 21st century man, it would also be 900 pages. Right. And you don't have to read it cover to cover. Right. It's meant, each chapter is like 5 or 10 pages. And so if you have prostate issues, you read my prostate chapter, it's about 8 or 9 pages. If you have hair loss, Miguel Canales is one of the national experts in hair loss. And so he wrote an amazing chapter. It's like 6 or 7 pages. So you don't have to read 900 pages to get the information you need. It's just, even though there was an amazing chapter written by a friend of mine, Susan Bratton, who's an amazing intimacy coach. And she wrote a chapter on how to please a woman.
Okay.
Right. 10 or 15 chapters that'll elevate your bedroom game. So there's every aspect of men's health for men over the age of 40 in this book.
I'll be buying it. I'll be getting that book. Yeah, I'll be getting that book. Yeah, I need to elevate my game. I need to level up, especially those chapters. You know what I mean? I can't just come in and I gotta go slow and appreciate the meal, right? Exactly. How do you know what it's like to starve if you never appreciate the meal if you never had to starve, right? So that's how I look at this, right? I got to starve to appreciate the meal, my man. Well, thank you, Dr. Judson Brandeis. I'm sorry, and I appreciate you, man. This is awesome, dude. You all right with me? You are all right with me, that's for sure. And I appreciate your time. Once again, this podcast can be seen on our YouTube channel, as well as downloaded from Men Speaking Out. And we're on all platforms, Apple, iHeartRadio, Google Play. I'm on every single platform out there in the world. And this is going to be heard all over the world. So thank you again, my friend. Awesome. I appreciate you.
Hey, thanks for having me on. I appreciate it.
Hey, wonderful, dude. Wonderful. God bless.
You too.
Right.
Bye-bye.